Um, Hello again, everybody. Welcome to our joint workshop on sustainability. This is a hugely important subject to everybody in the world. I am Andrew Spiegel. I'm the chair of the World Patients Alliance, and it's really my pleasure to welcome everybody to this webinar. I have been the board chair since we started the World Patients Alliance about 4 years ago. Most of my work before that was in the United States, running a colon cancer organization, and now I'm in the global arena running the Global Colon Cancer Association, as well as chairing the World Patients Alliance. Next slide. I just attended the International Hospital Federation's annual Congress in Lisbon, Portugal, and I was fortunate enough to have been invited to speak about the patient perspective on sustainability. And I learned so much at that conference on really the impact that the hospitals have on the planet and the amazing ideas that were put forth around the room on how to make hospitals really neutral by, I think it was 2030, I heard, but an amazing conference. And I know that next year, I just got an email this morning inviting us to go to next year's Congress, which will be in one of my favorite places, Rio de Janeiro. So a big thank you, Sylvia and Sarah, for inviting us to that, and best of luck on that. This was really a great conference. So anybody that's watching this or attending, I would highly recommend you consider going to their Congress next year. But it's my pleasure really to welcome everybody to this. I'll be brief. Next slide. The World Patients Alliance is a nonprofit organization of patient organizations and stakeholders. And our goal really is to make sure that the patient voice is at the center of all policy discussions that are being made around the world, and that patients' voice is strong and patients understand their disease. We have about 9 principles that are up on our website that guide all of the work that we do. And you can check that out at worldpatientsalliance.org. These are our current board of directors at our first meeting. That's me over on the left, and we have Regina Kamaga from Uganda. And then we have Carla from Peru. We have our fabulous executive director, Hussein Jaffrey, who runs everything at the World Patients Alliance. And then my friend Penny, who runs or did for 40 years, ran the American Chronic Pain Association. And everybody knows Jolanta Balinska from Poland, who's a outstanding advocate. So that's our board. Next slide. We currently have more than 460 patient organizations, and a few more have come in this week. So I think it's fair to say we're soon going to be around 500 patient organizations represented in 123 countries around the world. And you could see the geographic diversity really exists. And I know a bunch of applications have come in from those last 2 regions since we just held our regional Asia Pacific meeting in Dubai just last week. And so I know a whole bunch of applications have come in from that region. But that's who we are at the World Patients Alliance. We have obviously much to talk about our organization, but that's not why you're here today. I simply wanted to welcome everybody and then turn things over to Sylvia, who is from the Geneva Sustainability Center. We got to meet in Lisbon. It was really a pleasure. So, Sylvia, I turn things over to you. Worldly, is that my slide? Who's saying everything?
Let me just explain this slide. So basically, this is, this webinar is going to be, we have AI-powered simultaneous interpretation in 32 languages. So you can hear this webinar in your own language, both in text form or in audio. So all you need to do is there's going to be, if you look at the chat, there's a link. So if you click on that link and just, pick your language that you want to choose your language. So if you want to for English or Hindi or Russian or Arabic, just check that and then just put your name here. your name. And once you have done that, just click on attend, and then it will start the text start. But if you also want to hear the audio, there is a mic here on the top where the arrow is. Just click on that as well, so you will not hear the speakers, then you will hear the AI doing these simultaneous translation. So it's very easy. Just to select your language, put your name, click attend, and then if you want to hear it in your own language, just click on this speaker mic as well, and you will be hearing it everything in your own language. Next, and over to Sylvia.
Thank you very much, Andy and Hussein, for the introduction, and thank you everyone for joining. It's really a pleasure to be with you today. I am Sylvia from the Geneva Sustainability Center, and I'll be talking a little bit more about the International Hospital Federation, the Geneva Sustainability Center, which was launched by the International Hospital Federation, and also the work that we do and how we think that the healthcare sector can also involve the patients when it comes to tackling climate change and in their role towards decarbonization and resilience and sustainability of the healthcare sector. So I'll be talking, then I'll hand over to Hussein to also present. But in the meantime, I really encourage you to also think about any initiatives that you have heard of or that you would recommend to the healthcare sector to also involve the patient population and the communities on this journey. So next slide, please. So the International Hospital Federation was launched in 1929, was created in 1929, so quite a while ago. And the goal was really to represent the hospitals and their voice on the global stage. The goal was also to become a platform for knowledge exchange, for sharing best practices, and we mostly focused on healthcare management and leadership to highlight the role that leadership and management can have in resulting in positive health outcomes for the communities and for the planet. Next slide, please. And in 2022, the IHF launched the Geneva Sustainability Center to support the hospitals and its network to address environmental sustainability challenges. We realized that there was a gap, although we know that climate change is also a health crisis, and that the healthcare sector contributes to this issue. So the healthcare sector has a huge role to play, and we'll see this in the coming slides. And we really it's our mission to be there to support hospitals, health systems, and the hospital leaders to get started on this journey and have the information and the tools that they need to do this in an effective way. So why is this a problem? Next slide, please. What we know is that the healthcare sector is a big contributor to carbon emissions globally, and therefore has a very big role to play to decrease the carbon footprint and increase its resilience. Here you have a few numbers, and here is the 2022 report of the Lancet Count, and it's a commission that is focusing on climate and health. And actually yesterday, the 2023 report was launched and published. I'm going to put a link in the chat if you want to have a look at it. But the conclusions and the key facts are really that the health impacts of climate change are there already being felt. And that indeed the healthcare sector is also a contributor, also emits a lot of emissions, and therefore we have to think about how we can show the examples and take the lead in decarbonizing this sector. So here you have the number 5.2. If it was a country, it would be the fifth country that would emit the most carbon emissions. You can also consider it as twice the aviation sector, for instance. So it's really a big issue, but also a big opportunity to do better. Next slide, please. So here is a distorted map to see a little bit where the world the emissions come from, the carbon emissions. So we see that it's generally the global north and the BRICS that are emitting. But what is interesting is when we see on the next slide another map, is that we see this contrast of, next slide, please. We see the contrast with the global vulnerabilities, and we see that those who suffer the most are not the ones that contribute the most, and that therefore the impacts of climate change on health are going to be very much connected with other determinants of health, like the social ones and the different vulnerabilities. Next slide, please. So one thing to realize, and you'll have the chance to discover this slide as well in detail afterwards, but is that really the climate crisis is a health crisis as well. So we do see that a lot of the extreme weather events can be related to a worsened health condition or disruptive life events such as forced migration, for instance, which is going to be to have a direct or indirect impact on one's health. So we can see here a few of the things you're probably already familiar with, extreme heat or pollution and the impacts that they can have on health. We also see here, interestingly, that mental health impacts are there throughout the different events, and that it shouldn't be neglected either. So really, this is one of the key messages: is that climate crisis is a health crisis, and we have to be prepared for it. Next slide, please. So this is a different way to view it. This is a health crisis, but we have in there also the health system that we add in the equation. So we recognize that there are some vulnerability factors that you can see here on the left-hand side of the slide within the population. So some categories of the population that are going to be more at risk to climate events or to the exposure pathways, as you see in the center. But also the health system that has to be ready to have the capacity to be resilient in the face of climate change, but also to have the capacity to respond to the increasing needs of the patient populations by addressing the vulnerabilities and be ready to the different health outcomes that are arising. So the impacts will be, of course, on the health of the population, but also directly on the health facilities themselves. For instance, an earthquake that would destroy or damage a hospital, or the different impacts on the health systems in terms of finance, for instance. So what does this mean for the healthcare sector? Next slide, please. Is that we must recognize that the healthcare sector is an industry in its own right to address the climate change. One of the key arguments in favor of addressing climate change is that the cost of dealing with climate change is way less than what climate change is going to cost. And this is also very obvious in terms of health outcomes, and it's been acknowledged for a few years already that the health benefits of tackling climate change would be huge. And if we see it this way, like we see here at the bottom of the slide, when health is taken into account, climate change mitigation is an opportunity and not a cost. And therefore it's also a role to encourage every industry, but including the healthcare sector, to take action and mitigate climate change. Next slide, please. So in practice, what does it mean for the healthcare sector, and what do we promote as the Geneva Sustainability Center? Is that the healthcare sector can decarbonize, and there are a few ways that this can be done. Here on this slide, you see that everything that is in blue is really what the countries can do as identity, as entity, that they can decrease the carbon emissions of their own internal industry. But then we have also what the healthcare sector can do, and it has been identified as a lot of opportunities. So one of the ways would be to really work on the internal operations of the hospitals and the healthcare sector, to work on the supply chain, which is also a big contributor, but then also think about how we can play a role in the wider community and how it can influence the communities by acting as anchor institutions, for instance, with the different partners and providers that we would work with. So this is what we do at the Geneva Sustainability Center, is really detail how can this be put in practice and implemented, and how can hospitals get started on this journey to decarbonize their operations, their supply chain, and everything that they do. Of course, we always keep into account patient safety and quality of care, and we actually realize that if done the right way, it is improving the health outcomes and the quality of care. Next slide, please. So now what does it mean for the healthcare leaders that we really address? Here, this is a statement that the International Hospital Federation published last year. It was approved by all IHF members and also endorsed by partners, including by the Well Patients Alliance. And this statement really encourages the sector to address climate change at every level of the healthcare delivery. And this is what we also try to encourage through our activities and our different narrative. So I'll show you in the next slides what is it that we do at the center and how we work to make sure that this is understood. So this is here a way to represent our vision and show that it's really a holistic way to approach sustainability, to do low carbon, equitable, and resilient healthcare. So like I mentioned, we have to act on, the sources of emission and the environmental resources, but also identify the vulnerabilities that I mentioned earlier within the communities, and involve everyone that should have a seat at the table and really a voice to make sure that the change is relevant and also sustained over time. So although this may seem like, a heavy task and other things to take into account, we do build our activities to ensure that they support hospitals on this journey and that this is done in a relevant and understandable way. So for instance, and next slide, please. We have launched last month, actually during our Congress in Lisbon, the GSC Sustainability Accelerator tool, where hospitals can take an assessment to find out how they're doing on all these various areas and measure and track their progress thanks to a core set of key performance indicators. And then they can benchmark their performance against other hospitals locally and globally. So if anyone here is working in the healthcare sector and wonders about how their hospital is doing in terms of sustainability, they can go on the website, which is just listed on the next slide. And you can, of course, contact us if you have any question about it. Next slide, please. So now I'm going to focus a little bit more on some examples and how hospitals are actively trying to engage the patients on this journey. So we have identified 4 different strategies or ways that this can be done. And again, I would encourage you to just reflect a little bit on if you think of another way or a different strategy that could be implemented to encourage the healthcare sector to also engage the patients on this journey. Next slide, please. So the first one is really about healthcare, the healthcare sector and hospitals recognizing the health benefits and the other benefits of providing low carbon care and applying different prescribing practices. So, for instance, the first one is telemedicine, which is increasingly implemented in all settings and is often quoted as an alternative way to deliver low carbon care. Because, of course, it implies less people coming to the hospital, so reduced transportation, but also less unnecessary services provided, less material used, and therefore less waste. So this is something that has been already demonstrated in various areas. And there are a lot of examples out there that we can point you towards. Also, other measures actually also more related to health promotion and prevention. So produce prescription is really about having food as medicines to prevent or improve chronic health conditions such as obesity, diabetes, heart diseases, and blood pressure. So this is one of the things that can be a different way to prescribe. Another one is green prescribing, to have really nature-based intervention to improve mental health and physical health. And there are also a lot of examples. I show the benefits of this and how this has already been implemented in some hospitals and healthcare facilities. And the third one is active travel, which is really about prescribing or encouraging different types of transportation that involves a level of activity. So this has already demonstrated a lot of positive outcomes on health when it comes to lowering risks of cancer, heart diseases, but also mental health and depression. We have here on the slide, you'll see this guide is one of the resources that we have on our website, readily available on the IHF and Geneva Sustainability Center website, which is a guide that can support the healthcare professionals in understanding how, and the patients understanding how this can be helpful for the patients, what are the positive health outcomes, and so on. So this is really a first thing that we encourage for hospitals to do, is how does prescribing practices and lower carbon care actually improves the outcomes of the health outcomes of patients, but also the operational outcomes of the hospital. So here on this slide is a second strategy, which is really about integrating sustainability as part of the hospital design and experience for the patients and the communities. This is a hospital, so it's the one that is at the corner of the park. It's a children's hospital in the UK. It's the only one in Europe that is built in a park, and it's really to provide a good environment and experience for the patients. We also know the positive impacts of green spaces on health and recovery. But what is interesting is that they really also use this space as a way to promote health once more. So if we just go on the next slide, please. You may not see it very well because it's a bit small, but we see that they're now working on the park. So here in gray, you can see where the building actually is. And they're working on the park to ensure that there are different spaces to promote active sports and how to keep fit. So it's really the health promotion side of it. They'll also have boards and information to raise awareness and make sure that people can learn about the link between the planet and health and the nature. They have some natural drainage implemented there through native planting. So it's also the relevance of making sure that they're and really emphasizing the positive sides of having native and local plants. And they also do activities related to nature and biodiversity conservation to make sure that bees are coming back and so on. So it's really a kind of a holistic project to make sure that they can connect people, the communities, and the planet, and have healthcare delivered at the same time, at the same place. If we go on the next slide, please. It's a third strategy, which is really about actively engaging patients and communities in designing the sustainability strategy of an organization. So now an increasing number of hospitals is either designing or updating their sustainability strategy. And it's a great way to involve also the patients and the communities to know how they should, which practice they should implement, what should the priorities be, and how to also include a diversity of point of views. So this, for instance, is the strategy of the Geneva University Hospitals here in Switzerland, and their participatory approach to build their strategy, and actually won an IHF award for this strategy. So there are three key moments where patients are involved. The sustainability committee. So in all of their committees, they have a patient representative to make sure that they have also something to say in the committee. In the participatory approach, when they designed and gathered feedback for what they should implement as practices, they sent out a survey to the general public and to the patients to make sure that they would also gather some ideas beyond the hospital walls. And then in terms of the deployments, they're actively communicating to the population and the communities, but also when they train the staff, and this goes back to the prescribing practices, they make sure that the staff and the healthcare professionals understand their role to empower the patients when it comes to the low carbon care practices, but also active travel and so on. So it's really about making sure that there is also this awareness and health promotion aspect of and prevention aspect understood with the link of climate and health within the training for the staff. A second example of how to engage patients and communities, which is on the next slide, is again a children's hospital in the UK, which uses Clean Air Day to raise awareness about the impact of pollution on respiratory diseases, and more particularly for children. So every year they close the streets around the hospital so that there is no car circulating, and they ensure that the message about clean air is communicated broadly. They have activities about it, children drawing about how we should encourage clean air and what can be done around it. And so it's really about engaging the communities and the patient in awareness campaigns. And here is the example for clean air. I'll be done soon. My last slide is just about a last example, which is really about investing in the communities. And here it's an example that comes from Kenya, Nairobi, where the MP Shah is involved in a national project for reforestation. And their goal is really to grow trees in a community that is outside of Nairobi. And what's very interesting with this initiative is that there are really four aspects that we can highlight. One is the fact that by contributing to this national strategy, they highlight the hospital's commitment to environmental sustainability. So they really show that they can do things that are outside of the hospital walls and that have a link with climate as well. It also highlights the partnerships that can be done. So this specific piece of land that they have purchased to grow trees on it has been done in partnership with the Architectural Association of Kenya, for instance, but also the National Irrigation Authority. So we see that various sectors have to be aware. Sorry, you can stay on the previous slide, please. Thank you. Have to be engaged and involved in that. Cross partnerships can be leveraged for this purpose. Something also interesting is that they really emphasize that they're growing the trees versus just planting them. You will hear quite a lot of organizations and journals talking about planting trees, but actually saying that they're not guaranteeing that 1 year later the tree will still be there. So they really emphasize that they're here to grow them and leverage all the benefits that it will have. So for instance, it's they're using indigenous fruit trees, which means that it actually feeds the community. It creates a livelihood where people can sell the seedlings for other people to come and buy the trees, and recreates a source of income as well for the local community to, for instance, send the children to school. So we see that it also addresses environmental and social determinants of health, which in terms improves the health of the community. So we see really this win-win-win side of things with, it's positive for the hospital and for the community, for the health of the people and for the planet as well. So I'll stop there and I'll hand over to Andy to introduce Hussein. I thank you very much. Please don't hesitate to type some questions in the chat. I'll be happy to address them and I look forward to the discussion after Hussein's presentation. Thank you very much.
Thank you, Sylvia. That was really amazing and eye-opening for sure, and I'm sure there'll be questions for you at the end. With that, I'm going to introduce our co-founder, our board member, our executive director, Hussein Jaffrey, who runs the World Patients Alliance and makes all of these great partnerships and makes things happen. But he doesn't just have experience here. He's been in the patient community for decades and is the Secretary General of Alzheimer's Pakistan and is on the WHO's Patient for Patient Safety Program and all these other things here. I won't spend a half hour looking at talking about Hussein's credentials, but I'll turn things over to the great Hussein Jaffrey. We don't hear you, Hussein, but it doesn't look like you're muted.
Sorry.
Okay, here we go.
Can you hear me okay?
Yes.
Yeah, so thank you very much, Andy and Sylvia, for the kind introduction, and Sylvia for presenting a very comprehensive presentation on what IHF is doing. And I want to really appreciate IHF and Geneva Sustainability Center for raising this very important issue. And it was last year when I was in Dubai for the IHF conference, and I attended the conference, and the main theme was again sustainability, that I realized that not much has been done by the healthcare sector, although we are one of the the main polluters as well. But then I also realized that the patients have not really played their part and taken up their own responsibility in doing anything about it. So that's where the idea came that we need to prepare and empower patients on this issue as well. Yeah. So this is the overview of my presentation. I will be shedding light on what is sustainability and what is sustainability in healthcare, and what is patients' role in all of the sustainability efforts, and what are the ways patient can contribute in the efforts of sustainability. Moreover, I will also talk about the benefits of environmental sustainability. So let's start with what is environmental sustainability. The definition says that the environmental sustainability is the ability to maintain an ecological balance and conserve natural resources to support the well-being of future generations. So it basically aims to improve the quality of human life without, putting unnecessary strain on the Earth's supporting ecosystem. It's about creating an equilibrium between, communism and human culture and the living world. We can do this by living in a way that doesn't waste or unnecessarily deplete natural resources. Yeah. So, as I said, sustainability is crucial in global context as it safeguards the well-being of both present and future generations by responsibly managing resources, preserving the environment, addressing social equity, and maintaining economic viability. Sustainability plays a pivotal role in tackling pressing global challenges such as climate change. And apart from that, resource scarcity and social inequality. It provides a framework for fostering resilience and creating a balanced and prosperous future for the entire planet. As far as healthcare sector is concerned, sustainability is essential for delivering equitable and efficient healthcare services. It involves minimizing waste, reducing the environmental footprint of the healthcare practices, and promoting public health resilience in the face of global challenges such as pandemics and climate-related healthcare risks. So by adopting sustainable practices, the healthcare industry can ensure long-term well-being for both individuals and the planet. Healthcare sector also has a significant impact on the environment. So let's start with waste. The healthcare sector generates significant waste, including disposable medical supplies and packaging, contributing to environmental pollution. There are high energy demands in healthcare facilities, from lighting to medical equipment, so it increases the sector's carbon footprint and environmental impact. Then there's the issue of emissions that healthcare industry produces, such as from transportation, energy use, and waste incineration. This emission and energy consumption contribute to climate change, posing risk to global health through extreme weather events and altered disease patterns. Sustainable healthcare practices aim to minimize these impacts mainly through three ways. So first of all, resource efficiency. Sustainable healthcare practices prioritize resource efficiency to minimize consumption and promote responsible resources management within the health sector. Then it's the waste reduction that focuses on minimizing waste. Sustainable healthcare practices aim to implement strategies that reduce the environmental impact of healthcare-related waste, including proper disposal and recycling measures. And third is green healthcare infrastructure. So sustainable healthcare envisions environmentally friendly infrastructure integrating energy-efficient technologies, renewable energy resources, and eco-conscious designs to lessen the ecological footprint of healthcare facilities. Just a second. So all stakeholders need to play their part in sustainability efforts, including the patients. Empowered and informed patients possess the capacity to instigate change by advocating for enhanced healthcare outcomes, influencing policy decisions, and championing transparency and accountability within the healthcare system. Through their active engagement, patients play a pivotal role in driving improvements in patient care, fostering advancement in research, and evaluating the overall quality of healthcare services. Patients can go green by choosing and adhering to these practices. So let's discuss them. Patients can ensure proper disposal of medications by utilizing designated medication drop-off locations or following disposal guidelines. This will prevent water pollution, as improper disposal can lead to pharmaceuticals entering into water systems. Patients can also reduce plastic waste by bringing reusable bottles and bags, which help minimize plastic waste generated during medical visits, contributing to a more sustainable and eco-friendly healthcare experience. Then patients can also choose telehealth options whenever appropriate, thus reducing the travel-related emissions and the demand on healthcare facilities. Opting for sustainable transportation methods like walking, biking, or carpooling to healthcare appointments can reduce carbon emissions as well. Other examples include, medication adherence. For example, patient can adhere to prescribed medicines regimens, reducing the need for additional treatments, hospitalization, and waste associated with medication disposal. Moreover, regular checkups and preventive measures such as vaccinations and screenings can help avoid serious health issues, reducing the overall environmental and economic burden on the healthcare system. Patients can also advocate for sustainable healthcare practices within their communities and healthcare facilities, encouraging providers to adopt eco-friendly measures. So patients can advocate for environmentally conscious practices within healthcare facilities, encouraging the adoption of green initiatives, energy efficiency, and waste reduction measures. By being mindful to personal healthcare habits, such as choosing sustainable products and minimizing the unnecessary medical waste, patients can actively contribute to waste reduction and environmentally responsible healthcare policies. Moreover, patients have a role to play in promoting sustainable healthcare practices by making informed choices. And as I said earlier, advocating for environmentally responsible healthcare options, ultimately basically contributing to both their own well-being and the health of the planet. Patients can also be mindful of resource consumption during their hospital stays, such as water and electricity usage, and that can contribute to sustainability efforts. Patients can also use health monitoring devices and apps to check their health status, potentially catching issues early and minimizing the need for emergency care. And then patients can choose healthcare facilities that prioritize sustainability in their operations, such as those using renewable energy or offering sustainable food options. And last but not least, community engagement. So by engaging with local organizations and initiatives that promote sustainability and public health can lead to broader, positive impacts on the healthcare and the environment. Sustainability in healthcare yields a range of positive impacts, enhancing patients' outcomes regarding environmental harm and fostering a resilient and equitable healthcare system. So these are some of the significant positive impacts. Reduced healthcare cost in sustainability means implementing eco-friendly practices and preventive measures like vaccination programs to decrease medical expenses associated with preventable diseases. For example, widespread flu vaccinations reduce hospitalization and medical costs for influenza-related illnesses. Then healthier communities in sustainability if refer to improve public well-being through initiatives such as clean air policies and reducing pollution-related health issues. For instance, stricter health air quality regulations can lead to lower rates of respiratory illnesses like asthma in urban areas. Long-term resource preservation in healthcare involves responsible resource management, such as reducing water usage. So, for instance, installing water-saving fixtures in hospital reduces water consumption and ensures a sustainable supply for the future. Then improved air and water quality in healthcare involves reducing pollution emissions like switching to cleaner energy sources. So, for example, a hospital using solar panels to generate electricity reduces, air pollution and contributes to cleaner air quality in the community. Enhanced patient experience in healthcare involves measures like comfortable and energy efficient healthcare facilities. For instance, hospitals with natural lighting and improved indoor air quality provide a more pleasant and sustainable patient environment. And these are also some benefits for sustainability in healthcare. Reduced exposure to harmful substances in healthcare means minimizing patients' contact with toxins or allergens, such as through eco-friendly building materials. So, for example, using low volatile organic compound paint in hospital rooms enhances indoor air quality and reduces high risk for patients and respiratory conditions. Improved air quality in healthcare benefits respiratory patients by reducing airborne pollutants like using HEPA filters. So, for example, cleaner air can alleviate symptoms and improve the overall well-being of patients with conditions like asthma and chronic obstructive pulmonary disease. Sustainable practices in healthcare enhance overall well-being by fostering a healthy and healing environment, such as using green spaces for patient relaxation. So, for example, hospitals with gardens or natural landscape offer patients opportunities for stress reduction and improved mental health during their recovery. So this is my last, slide for the presentation. So here are some key takeaways. Sustainability in healthcare stands as a fundamental factor in fostering environmental responsibility and ensuring the enduring well-being of communities. Patients play a significant role in sustainability of healthcare, influencing positive changes through their choices, advocacy, and adherence to eco-friendly practices. And it's very important that we embark on this journey. Even small changes in healthcare practices, such as proper waste disposal or reducing plastic usage, can yield substantial environmental benefits, basically contributing to more sustainable and eco-conscious healthcare system. And collaborations and partnerships are vital in our sustainability efforts. There is a need that patients, hospitals, and other stakeholders join hands for sustainable healthcare systems globally. So before I hand over in my presentation, I just wanted to highlight a couple of events, our upcoming events. So one is on 1st of December. That's in collaboration with International Council of Nurses. And that webinar is going to be on patient-centered care and patient engagement. So we want the nurses and the patients to sit on one platform, have a shared understanding of what patient-centered healthcare is. So please register and join this webinar. Another webinar that we are organizing in February is on self-care. We are working with the World Health Organization because self-care is a way forward, because the current healthcare systems cannot really cope up with the number of patients that are there. And we need the patients to be empowered and take charge and involve in self-care that will not only help their own health, but also help the healthcare systems. And this is the last, I just wanted to announce that, we are going to have our second World Patient Conference next year in October, 19th and 20th of October in Cape Town, South Africa. We want all of you to be there. So please mark your diaries, and you will be hearing more on this very soon. So thank you very much for your kind listening.
Thank you, Hussein. Excellent presentation on what patients can do and really the impact that we can have. Really great, and some great questions that are coming in. So hopefully we get time to to answer those. Let's go to the next slide, and let's go to the next speaker. We are really happy to have, Sarah, who I also got to meet in Lisbon. Sarah, why don't you take it away from the IHF?
Yes, sure. Hi everyone. Nice to see you. I think we can start with a couple of questions. Maybe I saw in the Q&A box, there's a question that connects the cost of climate change and the retention of workforce. So maybe we can already address this question, which is how can we ensure we can continue to retaining workforce despite the growing challenges related with climate change? Maybe Sylvia, you want to start to respond with this one?
Yes, thank you very much, Sarah. And indeed, it's true that, and thank you for the question. It's true that we do see that there is a big cost to climate change, and the thing is that it's only going to get more costly. So it's another reason why every sector, industry, and individual should start their efforts right away, or if not already started. And also, it shows the importance when we think of the connection with the health workforce. The connection of environmental sustainability strategies with the overall agenda of healthcare delivery, and how indeed working on more sustainable practices are also going to be contributing to the overall sustainability agenda, which of course also include the workforce. One of the things that we know is that, for instance, and there are some case studies and examples of this, is when you start implementing environmental sustainability initiatives in the hospitals, or when you start training the staff about those questions, and especially when you say, to health professionals that it improves the health outcomes and the health of the patients, it increases the motivation of the staff, generally. So it does also have an impact on staff retention. We see that, in some settings where the staff is, of course, there's a shortage situation, burnout situations, they still manage to find the time and the motivation to have some challenges, some campaigns within the hospital to make sure that some of the environmental sustainability practices are being implemented. So it's not going to solve the issue, but it's one of the things that can contribute to improving the situation, knowing that there are indeed some cost related and staffing implications due to climate change. So I hope it answers the question.
I believe so. And if I am correct, I think between Sylvia and Hussein, there will be a little exchange because I don't see any more questions in the Q&A. So maybe between you and Hussein, you can have a little exchange on a couple of points that has been presented today and solutions that can, practical solutions that we can look forward from both the hospital and the patient side.
Thank you,
Sylvia,
Sarah.
go ahead.
I can take it. But yeah, no, Hussein, it was very interesting to also have your perspectives and showing a little bit what the patients can do. You highlighted the role of advocacy, of course, which is a huge one, to also influence the policies. But what would you think, as to represent the patient associations, what do you think should be some key recommendation that we should be giving to our audience, which is hospital leaders and the healthcare sector, to engage the patients more in this discussion?
Yeah, thank you, Sylvia. And I think there's much that we can work together with patients and hospitals on this very important issue. So one of the key recommendation to hospital leadership for engaging patients in sustainability within healthcare would be to create transparent communication channels. Hospital can establish platforms on regular forums where patients can learn from the hospital sustainability initiatives and provide feedback or suggestions. Additionally, incorporating educational materials on sessions for patients on how they can participate or how can they make lifestyle changes that can also really contribute on to sustainability healthcare practices, and it will be very beneficial for both hospitals and patients as well. And then engaging patients through interactive workshops, awareness campaigns or support group or sustainable healthcare practices can really foster a sense of shared responsibility and encourage active involvement in sustainability efforts. And moreover, I think an international hospital and Federation and World Patient Alliance should work into, enter into partnership and involving their members and countries to work collaboratively at hospital levels. So it's not only at the main international level. I think we can also maybe have projects at the local level where our patients can work together with your hospitals towards environmental sustainability. So that's, I think, some of the recommendations that I have. But I also have a question for you, if I may. So what are your recommendations to patient and patients organization? How can they collaborate, as you think, patients and patient organization with the hospitals?
Thank you, and thank you for your answer. And I took notes to make sure we make good use of this information. And I really like making sure there is communication and engagement. Some workshops to make sure that there is some discussions about the making sure the information is clear for everyone. And I think that this is really one of the first advice that I will also have is really about getting involved. And also highlighting the good examples that exist. And I in the chat again, if you have any example, I mean, we do like to highlight good case studies where we can really show, okay, this happened in this setting and it worked. And so having good examples of how patients got involved and had an impact is very valuable for us to show that it should be done more globally. You did talk about the advocacy, but then really, I think the information and the healthcare sector does have a role to provide this information, but there's also a lot of information out there by recognizing the risks on the health patient, but also the benefits on the health patient to have a hospital that is going to also provide some lower carbon care and be more resilient, because now we see how climate change also has an impact on the resilience of the hospital itself and on the population's health, and the hospitals and the government should be accountable as well to make sure that they implement some measures and processes that are going to be supporting and mitigating climate change and supporting the populations accordingly. So really just knowing the risks and knowing the benefits to ask questions and ask for accountability is very important. Then ask questions, when you go to an appointment or the hospital, asking questions about it with the information that you have acquired is always going to be beneficial. And then, and of course, adopting some sustainability practices at home, just recognizing that it's more than what the hospitals will do. It's also every individual efforts. So also recognizing the impact of climate change more globally and having some practices also as individuals that would contribute to this effort. I will also just conclude by saying that you will hear a lot now about environmental sustainabilities and organizations doing increasing efforts, or at least talking a lot more about their efforts. And we're really hoping that the healthcare sector is, we see that it's increasingly being engaged and involved. But we also see that, the health of the patient is what is going to sustain the argument of patient health and population and the planet health is going to be what is going to sustain this effort over time. So there is a huge role there that everyone has to play in really recognizing the potential for health itself. And it is an opportunity to really also shift the way health systems function to be really more providing and promoting health to the communities rather than just treating sickness. So I'll stop there. I don't know if you had anything to add, Hussein, and I'm sorry if maybe we didn't have time to take all the questions. I see there are actually some in the chat, so we may be able to address them by email in the follow-ups. But this was my closing, and I'll hand over to you, Hussein, if you have anything to add.
No, Sylvia, I think you have really concluded it very well. So we just have about 2-3 minutes left. So I will hand over to Sara Perazi, who is the Senior Partnership and Program Manager at the International Hospital Federation, for her concluding remarks.
Thank you so much, Hussein. Thank you to everyone who participated in this inspiring and engaging discussion. I think most has been said. I saw a few questions again in the chat, and we will reply to them by email as a follow-up, of course. But now it's probably time to act. And I'm pretty sure that most of you will agree with me by saying that this session highlighted that sustainability is not just one person or one group alone responsibility. It's everyone's responsibility, and we share it. So we have seen significant environmental impacts on hospitals, and thanks to Silvia, we also have seen how hospitals can decrease carbon emission, like internal operations, supply chain, involving the communities. And Hussein also gave us a great example on how patients can contribute to tackle these issues. So to respond to the sustainability challenges that are there today and will be still there tomorrow, we need to work together. And as a senior partnership, I really think that international collaboration and collaboration with all the different stakeholders is super important, is the basic to move forward. So we at the IHF and at Geneva Sustainability Center, we believe that involving patients is also one of the steps that we should take forward. And we, on our perspective, we welcome webinars like the one we had today. And from your comments, I think you appreciate them too, because it's one way to create opportunities, new opportunities to discuss those challenging and learning how we can do different and better. The IHF and the World Patient Alliance are long-standing partners, and so we really value this collaboration, and we hope that we will bring it a step further on the discussion around sustainability. And to that end, I would like to mention that the Geneva Sustainability Center has created the so-called Getting Started guides, which offer actionable ideas and pathways for healthcare organizations to take immediate and effective steps on sustainability and climate resilience. And we will be delighted to work with the WPA to develop a Getting Started guide on how to engage patients. And the aim is to really create a collaborative document that will provide guidance on both how hospitals can engage with patients, and how patients can actively address to hospitals. In conclusion, I just want to thank Andy, Hussein, Silvia, and all the attendees for participating. And so if you have any question or example of your work, please feel free to reach out to us. And of course, we're looking forward to see many of you in person next year in Rio de Janeiro in September for our World Hospital Congress that Andy, Hussein mentioned, and we look forward to continue the discussion. Thank you very much.
Thank you, Sarah. And just one last thing, the recording of this workshop, along with the presentation, will be uploaded on our websites very soon, and we will be sending you the links for these as well. So thank you very much for your participation, and it's goodbye. Thank you.
Thank you, everyone.
Thank
Bye-bye.
you.
Thank you.
Thank you
Have
very
a good day. Thank you for participation.